Hi, I'm Dr. Anusha Somavarapu, work as a consultant in the Department of Emergency Medicine at Continental Hospitals, Hyderabad. Today, let us have a brief awareness about brain stroke. Worldwide, brain stroke, second leading cause of the death, third leading cause of the disability. Brain stroke affects 1 in 4 of us. There are two main types of brain stroke. One is a ischemic stroke, another one hemorrhagic stroke. Ischemic strokes are caused by blockage or narrowing of blood vessels in the brain. Hemorrhagic strokes are caused by rupture of the blood vessels in the brain. Ischemic strokes accounts for the majority of the cases, around 80 to 85%. Ischemic strokes can occur due to blood clot formation within the blood vessels in the brain, or a clot that travels another part of the body and lodges into the brain arteries. Hemorrhagic strokes are less common but tend to be more severe. This happens when a blood vessels in the brain ruptures, leaks, causing a bleeding and damaging a surrounding brain tissue. Next, what are the risk factors for brain stroke? One of the most important clinical risk factor is high blood pressure levels. Along with that, uncontrolled sugar levels, high cholesterol levels, excessive tobacco consumption, harmful alcohol intake, sedentary lifestyles, depression, stress, and genetic predispositions. In addition to this, having a heart condition called dysarrhythmia, especially atrial fibrillation, that is abnormal heart rhythm, leads to increases the chances of having a brain stroke. Next is the signs and symptoms of a brain stroke. We remember a brain stroke with the acronym called B FAST. B stands for balance, sudden loss of balance, giddiness, headache, and E stands for eye issues, sudden loss of vision, blurring of vision, double vision. F stands for the facial asymmetry, weakness in one side of the face, deviation of the mouth, unable to closure of the eye. Arm stands for arm weakness, numbness and arm weakness in one side of the arm. S stands for speech, slurring of speech, unable to speak. Time. Note the time of symptoms started. Make sure time is important. If you or loved ones demonstrating B FAST symptoms, call emergency services, shift nearby hospital immediately where equipped specialized doctors are available. How to prevent a stroke? Stroke most commonly seen in elderly age group more than 60 years. It can also be seen in the younger age group. 90% of the strokes can be prevented by controlling the blood pressure levels, sugar levels, maintaining low cholesterol levels, having a healthy lifestyle, healthy diet including fresh vegetables, fresh fruits, decreased intake of processed foods, and exercise 5 times a week minimum. 1/3 of stroke cases attributed to inadequate exercise. Next, how is this condition is treated? If you reach a hospital within 4.5 hours, you will be given injection called a tissue plasminogen activator or a thrombolytic drug injected into your blood veins. Clots can be dissolved immediately and you can return to your normal condition, but it has to be done in a 4.5 hours time under supervision of equipped and specialized doctors. So it is important to recognize B FAST symptoms immediately and reach the hospital. Confirm that you don't have another type of hemorrhagic stroke that can easily identified in the CT scan. Hemorrhagic stroke requires different management strategies like controlling the bleeding, reducing the pressure in the brain, and preventing further brain damage. Surgery may also require to repair abnormal blood vessels, remove blood clots. So act fast. If time is saved, is brain saved. The Continental Institute of Emergency Trauma Services Critical Care Management is a level 1 tertiary comprehensive center, is equipped highly qualified emergency physicians around the clock to deal with every single critical and life threatening conditions. Our Continental Life Care on Wheels ambulance services has efficient high-tech line of ambulances 24/7 available to transport critically ill and trauma patients. Thank you. I think this video must have been helpful for you.